Hi friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. So we are starting to see some of the fallout from the COVID-19 vaccine, what I call the reformat. So that's what I'm going to call it from here on out, the reformat. One of the things that's happening is that there is an autoimmune response. And if you've listened to my previous videos, you know that was one of my big concerns, was an autoimmune response. And what's happening to some people as after they get the reformat is their body is turning upon itself. And in their cases, it's killing the platelets in the blood, which are the little tiny pieces of blood material that form a clot. So if you've ever had a scab, which we all have, that red hard stuff that's in the scab is platelets that clotted your wound, which is a good thing. What happens with the reformat is your body turns on itself. It decreases the numbers of platelets. In a case that I'm aware of, normal would be between 150,000 to 400,000 is normal. The platelet count was down to 400. That's a huge problem. And this was a man age 65. It was not a young female, and it was not one of the 6 that's been reported. So if you think that every single case of this cerebral venous sinus thrombosis, which is the clotting that occurred in the brain, if you think you've heard about all the cases, you are mistaken. Only somewhere between 1 and 10% of adverse reactions from vaccines are actually reported. So this is what happens. I'm going to share screen with you right now. And I want to go to, this is from, one of my favorite YouTube channels is MedCram. So this is from MedCram, and they had a discussion with a medical doctor about CVST, which is a cerebral vascular sinus thrombosis, which is what is occurring with the Johnson & Johnson vaccine, which is the same as AstraZeneca. And I'm going to do a little detour here to talk about blood clots related to Pfizer and Moderna, which is a real thing. And it says right here in this, in the text, that according to a study that was created or published, or actually not quite published by Oxford University, 4 in 1 million people experience this CVST after getting the Pfizer and Moderna versus 5 in 1 million people. That sounds like a low number, which it is. And they will say that there is no blood clots. If you read some headlines, it'll say there is no blood clots reported. This is because they're comparing it to people that have gotten COVID-19, the disease. And we all know back in 2020, especially if you listen to my YouTube video on what if COVID strikes, blood clotting is one of those things. There's thrombosis that was related to COVID-19, and you should be taking an aspirin a day for 2 weeks should you get a positive test. So we already know that about COVID-19, so we can't compare the reformat to the actual disease. What we're looking for is problems that are starting to occur. And the reason why I'm so concerned is because the problems are occurring because the body is turning upon itself. Frightening. So what my purpose of the video today is to tell you what to look for, because if somebody shows up with a blood clot symptoms, the first reaction by conventional medical care is to give you a drug called heparin. And this would be exactly the wrong thing to do in this particular case. The heparin would kill you. There needs to be other blood thinning drugs administered. So the symptoms of the CVST do include, now the blood clot can form in the brain, which that would cause symptoms of headache, abnormal vision, stroke symptoms, which would be paralysis, which means complete weakness on one side of the body versus the other, which can also happen in the face, and seizures is another symptom. The blood clot from the reformat can also occur in other areas of the body, like the arms or the legs. And in that case, you would have swelling of the leg, swelling of the arm. You could have discoloration. You could see a lot of bruising, which may be an early sign, and that would be not at the site of the Reformat injection. It would be in other areas of the body. Also, what they call pinpoint bruising, which is a sign that there could be a blood clot there. Other symptoms could be shortness of breath because the blood clot can occur in the lungs, also chest pain, abdominal pain. So now here's the juice about this. Yes, if you have blood clot symptoms, go to the hospital, but the hospital doctors and staff need to know that this person had a recent reformat vaccine injection. They need to know that because, as I said, if they just do follow the algorithm for a conventional medical model, which I talk about algorithms and how they play a huge part in the care that you get in a conventional medical facility in Stealth Health, if they just follow their algorithm, the person will be in grave danger, as though they're not already in grave danger. So please share this. I ran into an EMT, an ambulance EMT recently, and he fully supports that people need to be warned about this. So there's not a knee-jerk reaction that question needs to be asked. If it is not, please help the person out or help yourself out by volunteering that information that this could be a reformat reaction. So be well, take care of each other. As always, I invite you to take back your knowledge and your power so you may get your greatest joy out of life. Bye for now.